Advancing Equity and Justice is the book that I wish I had at the start of my public health career and all throughout. It really gets to the question of why are things the way that they are? Why do we see unjust health disparities that are so stubbornly persistent? We get into answers in the book. We really hope that it will be both inspiring for folks, but also very usable and practical, especially in this current moment. Equity and justice are foundational to the practice of public health. At its heart, equity and justice are both different applications and expressions of the idea of fairness, which are foundational to our society, to our democracy, and to community health. Equity essentially means giving people what they need to flourish. And justice is transforming systems to make sure that people have those conditions. Both are complementary, both are useful, and both have to be core strategies to how we do our practice of public health. Public health has a lot to be proud of. We have been behind some of the most powerful wins in improving people's health and safety and well-being on a massive scale. So I think before we get to the question of where we've fallen short, we should really pause and celebrate that we have been such a force for equity and justice. And I think we can go further. A big part of that is by fundamentally reimagining ourselves from a professionalized, siloed discipline to a social movement. I think that our work would change virtually overnight if we thought of ourselves as building and nurturing a movement. And the people we would bring to the table, the way we would do our work would really change. We would be in the business of shifting power. We would be in the business of human flourishing. And we would be in the business of building a big tent, something everyone wants to be a part of and that people want to get behind. If you've ever been in a meeting and someone said the hard thing and you had this feeling of, thank goodness someone said it, this book represents that to me. All those moments that maybe we sat around in a room, we asked hard questions, there were things that people were afraid to say or name, they're named in this book. So my hope is that people can read this conversation and they can accelerate their work, they can accelerate the conversations they're having so that we understand why are things the way they are, and we open up a whole new horizon of possibilities for how we can get to where we need to go if our goal is not just people surviving and having the basic things they need to live, and they should have that, but go all the way to flourishing. So I hope that folks really see the interdisciplinary nature of the book and of public health, and they get excited to interact with the incredible illustrations. These are hard and difficult concepts. We've really tried to break it down in a visual and understandable way.